All right, this morning a Metro Atlanta woman is speaking out, upset a federal program has failed to fulfill its promises despite 4 years of waiting. Beverly's story helped her husband file a claim with the CICP. That's the Countermeasure Injury Compensation Program. Senior investigative reporter Rebecca Lindstrom joins us now. And first of all, explain the CICP and what it's supposed to do.
And thank goodness for those letters, because it is a mouthful, isn't it? The focus of the CICP right now is to help reimburse people impacted by COVID-related treatments. There are more than 13,000 claims from people who say they were injured in some way by a countermeasure or a treatment for COVID that the government asked its citizens to take. You remember back in 2020, 2021? And while most of those claims relate to the COVID vaccine, there are also claims for the use of ventilators and drugs like remdesivir.
I gotcha. So what happened to Beverly's husband?
His claim is related to the vaccine. 6 days after he received it, he was rushed to the hospital. It turned out to be a brainstem stroke. He had to learn to walk and speak all over again, but his health problems, they just kept coming, and Beverly filed a claim with the CICP in 2021. She is frustrated that her husband died before his claim was even considered.
He was just full of grace. And he was very courageous, and he was very determined. And it took him 4 years. I thanked his whole team of doctors. Gave us 4 years with him. But yeah, both of us, knew, and we understood that there was no way they could know that this would happen to a minority of people.
Rebecca, do you think his case fell through the cracks, or do you think there's something bigger here?
I have been reporting, Chesley, on the CICP now for 3 years. And when it started receiving claims, the office had only four employees. Now, under the Biden administration, staffing did increase significantly, but it is unclear if it has now been impacted by the recent budget and staffing cuts. What we do know is that 98% of the COVID-related claims that have been processed have been denied, and only 34 claims have received compensation so far, most of them receiving around $4,000 apiece.
All right, has the CICP given any explanation as to why it hasn't processed these claims?
Well, Beverly says, at least in her case, the last holdup was a document proving her husband actually received the vaccine. And she says that's baffling because she has sent thousands of pages of medical records as part of her claim. But in this case, they wanted proof he actually received the vaccine. And that is really bizarre because of all that information, it is on the actual application. You can't even submit a claim without it.
Has there been any improvement since you started reporting on this issue?
Yeah, I mean, the CICP has greatly improved transparency. It has hired more workers, as we mentioned earlier, creating an online portal, relying less on snail mail. But even at this pace, I calculated it, and it would still take more than 6 years to get through every claim that has been filed.
Wow. So for those who have received compensation, what types of injuries are those folks experiencing? Well,
we were taking a look at that. Most of those relate to an inflammation of the heart muscle. There is also a disorder that's involved with blood clots and low platelet count. So, I mean, we're talking about some really specific things here.
How big are the payments that people are receiving?
They range from about $1,000 to $2.5 million. And I just want to say there is no payment for pain and suffering. So you only get a payment if you have a tangible cost associated with the treatment care that you've needed to receive. So we're talking about like a copay from something that your health insurance didn't pay, or you had to pay a certain part of the balance, or maybe you had to take time off work in order to get treatment. So it will only reimburse tangible costs. So there's some people who've had claims that were approved, but there just wasn't any tangible cost, so they didn't get a payout.
What would be some of the reasons that they would deny the claims?
Well, the key reasons that they've given is the lack of medical records, perhaps the records you provided didn't meet that standard of proof, but the number one thing is they say people just simply missed the filing deadline. You only have a year.
All right, Rebecca, thanks so much. We appreciate that. Thank you for keeping your eye on the federal agency. Rebecca will have more on this investigation on 11Alive News at 6 o'clock right here on 11Alive Plus and on the ATL. All right. We have a tip you want to share with our Investigates team? Well, you can call Rebecca at 404-873-9111. Again, it's 404-873-9111, or email her at investigates@11alive.com.